health problem in India, with nearly 7 to 9 lakh new cases occurring every year in the country. It is estimated that there are 2 minus 2.5 million cases of cancer in the country at any given point of time. With the objectives of prevention, early diagnosis, and treatment, the National Cancer Control Program was launched in 1975 to 1976. In view of the magnitude of the problem and gaps in the availability of cancer treatment gaps in the availability of cancer treatment facilities across the country, the program was revised in 1984 to 1985, and subsequently in December 2004. In the year 2011, the program was integrated program national program was integrated with national cancer, diabetes, cardiovascular disease, and stroke. The objectives of the program are: number one, primary prevention of cancers by health education; secondary prevention, that is early detection and diagnosis of common cancer such as cancer of cervix, mouth, breast, and tobacco related cancer by screening, self examination method, and tertiary prevention of strengthening of the existing institution of comprehensive therapy including palliative care. Tobacco control legislation. A comprehensive tobacco control legislation titled The Cigarettes and Other Tobacco Products, prohibition of advertisement and regulation of trade and commerce, production, sleep, supply, and distribution. Act 2003 was passed by the Parliament in April 2003 and notified in the Gazette of India. On 25 February 2004. The important provisions of the Act are: prohibition of smoking in public places. Now, Part B, prohibition of direct and indirect advertisement of cigarette and other products. Prohibition of sale of cigarette and other tobacco products to a person below the age of 18 years. Prohibition of sale of tobacco products near the educational institutes. Mandatory depiction of statutory warnings, including petroleum warnings on tobacco packs, etc. Mandatory depiction of tear and nicotine contents along with maximum permissible limits on tobacco packs. National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. India is experiencing a rapid health transition with large and rising burden of chronic non-communicable diseases. Short form NCDs, especially cardiovascular diseases, diabetes mellitus, cancer, stroke, and chronic lung diseases. Considering the fact that NCDs are suppressing the burden of communicable diseases in India, and the existing health system is mainly focused on communicable diseases, need for national programs on prevention and control of cardiovascular diseases, and stroke was envisaged, keeping in view that there are common preventable risk factors for cancer, diabetes, CVD, and stroke. Government of India initiated a national program for prevention and control of cancer, diabetes, cardiovascular diseases, and stroke during 2010-2011. after integrating the National Cancer Control Program (NCCP) with it. The focus of NPCD-CS is on promotion of healthy lifestyle, early diagnosis and management of diabetes, hypertension, cardiovascular diseases, and common cancers. Example: cervix cancer, breast cancer, and ovary cancer, oral cancer. Sorry. Objectives of the NPCD-CS program are health promotion through behavior change with involvement of community, civil society, community-based organization, media, etc. Opportunistic screening at all levels in the healthcare delivery system from subcenters and above for early detection of diabetes, hypertension, and common cancers. Outreach campuses are also envisaged to prevent and control non-communicable diseases, especially cancer, diabetes, CVDs, and stroke. To build capacity at various levels of healthcare, sorry, for prevention, early diagnosis, treatment, IEC, BCC, operational research and rehabilitation. To support for diagnosis, to sorry for that to support for diagnosis and cost effective treatment at primary, secondary and tertiary levels of healthcare, and support for development of database of NCDs through surveillance system, and to monitor NCDs morbidity, mortality, and risk factors. The package of services at subcenters, PSC, and CHC FRU levels of health systems are as follows: Health Facility Package of Services, Subcenter Health Promotion for Behavior Change and Counseling, opportunistic screening using BP measurement and blood glucose by glucose strip method, identification of early warning signals of common cancer, and referral suspected cases of CHC nearby health facility. PHC Health Promotion for Behavior Change and Counseling. Opportunistic screening using BP measurement and blood glucose by glucose strip method, clinical diagnosis and treatment of simple cases of hypertension and diabetes. Identification of early warning signals of common cancer, and referral of suspected cases to CHC. CHC by FRU. Prevention and health promotion, including counseling, early diagnosis through clinical and laboratory investigations, common lab investigations, blood pressure, lipid profile, ECG, ultrasound, X-ray, etc. If not available, may be outsourced. Management of common CVD, diabetes, and stroke causes. Opportunistic screening of common cancers, oral, breast, cervix, and prostate. Referral of difficult cases to district hospital, higher healthcare facility. Number two, National Program for Control and Treatment of Optional Diseases. Government of India launched a scheme called National Program for Control and Treatment of Optional Disease in 1998-1999. The National Institute of Occupational Health, Ahmedabad ICMR has been identified as the nodal agency for this program. The following research projects have been proposed by the government: prevention, control, and treatment of silicosis and silicotuberculosis in aga- agate industry, occupational health problems of tobacco harvesters and their prevention. hazardous process and chemicals database generation, documentation and information dissemination, capacity building to promote research, education, training at National Institution of Occupational Disease, Health Institution of Occupational Disease, health risk assessment and development of intervention program in cottage industries with high risk of silicosis, prevention and control of occupational health, control of occupational health hazards among salt workers in the remote desert areas of Gujarat and western Rajasthan. National Water Supply and Sanitation Program. The National Water Supply and Sanitation Program was initiated in 1954 with the objective of providing safe water supply and adequate drainage arrangements for the entire rural and urban population of the country. The central government is provided long range loans to states for implementing our urban water supply schemes and outright grants equal to half of the cost for implementing the rural water supply schemes. The stipulated norms of water supply is 40 liters of safe drinking water per capita per day and at least one hand pump sport source for every 250 persons. Information, education, and communication is an integral part of rural sanitation program to adopt proper environmental sanitation practices including disposal of garbage, refuse and wastewater, and to convert all existing dry latrines into low-cost sanitary latrines. The priority is to evolve financially valuable sewerage systems in big cities and important pilgrims and tourist centers and recycling of treatment effluents for horticulture, irrigation and other non-domestic purposes. Siva Jal Dahra Siva Jal Siva Jal Dahra was launched on 25 December 2022. Siva Jal Dahra has certain fundamental reform principles which need to be adhered to by the government or state government and the implementing agencies. Siva Jal Dahra is a community led participator program which aims at providing safe drinking water in rural areas with full ownership of the community, building awareness among the village community on the management of drinking water project including better hygiene practices and encouraging water conservation practices along with rainwater harvesting. Minimum needs program. The minimum needs program MNP short form was introduced in the first year of fifth year plan. The objective of the program is to provide sorry for that. The objective of the program is to provide certain basic minimum needs and thereby improve the living standards of the people. It is the expression of the commitment of the government for the social and economic development of the community, particularly by underprivileged and under served population. The program includes the following components. Number one, rural health, rural water supply, rural electrification, elementary education, adult education, nutrition, environmental improvement of urban slums, houses for landless laborers. Today is enough. Thank you for watching. Thank you so much. Bye bye. Oh, I think it's too much important. 20 points program. In addition to the 5-year plan and programs in 1975, the government of India initiated of special activity. This was the 20-point program described as an agenda for national action to promote social justice and economic growth. At least 8 out of 20 points are related directly or indirectly to health. Thank you so much for watching. Thank you. Bye bye.